We emphasize the patient rather than the surgery. We believe that a program to be successful long-term must look at the operation solely as a tool. We think it's a mistake to rely on the technical procedure itself as the panacea for the patient. Patients all undergo a psychological profile, and in addition, patients are tested for Helicobacter pylori, an organism that resides in the distal part of the stomach. If they do have H. pylori, then they are eradicated before surgery because we cannot monitor the behavior of the organism after the Roux-en-Y procedure. Approximately 10 to 15% of our patients receive a greenfield filter because they are at high risk.
I'm sorry, what kind of filter?
A greenfield filter or a vena cava filter to help prevent pulmonary emboli. So as you can see, there are a whole host of things that need to be done to process the patient, to select the patient, and to make sure that the patient is psychologically prepared to undergo a life-altering procedure. Attitude and commitment is important. Our patients are followed up forever. This is not a field where one takes out a gallbladder and refers the patient back to the primary care physician. That's a big mistake. We have to follow the patients long term. We also have to appreciate that when patients lose weight, that there are micronutrient deficiencies that can take place. And they have to, rather than correcting those, they should be prevented. And that's why we have a number of products that have been developed for the gastric bypass patient that we use. And we use the products prior to surgery to get the patient acclimated to, as an example, most of our patients are starchaholics. So we eliminate starches, not carbohydrates, but we eliminate starches preoperatively, along with trans fats, and then patients are placed on a fractionated whey protein. So that when they go to the operation, they can heal their incision and keep hair loss down to a minimum, because hair is protein. The nails can become brittle, teeth can become soft, one can develop resorption of muscle mass with weight loss. And we want to minimize all of these different changes, especially the trophic changes. And to do that, it's necessary for patients to be on micronutrient replacement. Once they become acclimated to the program and they're exercising, they're eating small meals, and they've lost weight, and they feel very well about themselves, then they're going to go and have the biggest stress test that they've ever had, and that's the surgery.